All throughout the programme this week, we'll be marking the 5th anniversary of the outbreak of the COVID pandemic. 5 years on since we all became very familiar with that phrase, coronavirus and COVID. The long COVID support group has found that only 45 adult post-COVID services remain open in the whole of the country, down from a peak of 121 during the pandemic. More than half of the long COVID clinics have now been closed by local integrated care boards. Elena Nibb is from Warwick, diagnosed with long COVID, joins me this morning on CWR. Hi, Elena.
Hi.
Thanks for joining us this morning. Tell us a bit about your story then, and how you contracted COVID and how it became long COVID for you.
So before COVID, I was working as an environmental health practitioner in a council down at Devon. So I worked all throughout lockdowns, and then lockdown was eased in 2022. Then unfortunately, I caught COVID in August 2022. And since then, it was just a slow decline into long COVID.
Mm. I mean, how old are you? You sound quite young there, Elena.
Yeah, I'm 28, so right. I caught it when I was 25.
Right. And you were fit and active. I know you played badminton, didn't you? So how's all this affected you?
Yeah, I played in a badminton league, so I was fit, could play badminton for 3 hours straight.
Right. But not now?
No, now I can't play at all.
Right. What do you make of the nature of long COVID, the support you now get within the NHS?
Yeah, so I was referred to the long COVID at Stratford after having to move back to the West Midlands to support my parents because I was too unwell to live on my own down in Devon. And I went there expecting some help. And when I arrived, unfortunately, I was told that I was sort of just deconditioned from physical inactivity. Right. But I very much interpreted that as being called unfit. Yeah. Which I didn't really understand, because suddenly I was fit and then suddenly I wasn't and couldn't do the things I could previously do.
So having played badminton, for 3 hours at a time, is it possible for you now to go out and just walk, for example? On good days, I can walk a little bit. So I've got to the point now where I can do my household chores. But before, during its worst, I couldn't even watch TV because it was too much mental energy to concentrate. So let's get this straight. You've lost your job. You can't play your sport anymore. You've had to move in with your parents, and clearly this has had a huge effect, as you just said there, on your mental health as well.
Yeah, it's really awful to train for all those years and to get your degrees, get fully qualified, and then suddenly you can't work anymore. It's really horrible.
Do you think there's enough understanding, Elena, of the long COVID condition?
I don't think there is, no, because I went to the clinic in 2023, and then other advice I received there was to go for a walk twice a week, right, and that most people will get better on their own, when that's just not the case, and is very inappropriate advice, sort of post-viral fatigues.
So what would your message be now? I mean, 5 years on, clearly you don't feel as though there's much support for you within the NHS. I know you've had to access private healthcare, haven't you, which thankfully you've had some help and support with on that. What would you be saying to the rest of us for whom, COVID is, for many people, a distant memory now 5 years ago?
Yeah, I think they need to be aware that you can still get long COVID, unfortunately. And I was fully vaccinated and I still went on to develop it. And the NHS really needs to work with these private experts. So I went to Dr. Finley's private practice and saw Dr. Sinclair. And he was able to run more in-depth testing, and he found things that were physically wrong with me through, say, cytokine tests, chronic infections, and I also did some marker tests that determined if I'd be suitable for monoclonal antibodies, because we're waiting for approval for new drugs to then treat the disease. So we need Evershell 2 to be approved by NICE, so I can potentially treat long COVID.
Well, Elena, I can still hear the struggle in your voice, frankly, just trying to hold this conversation. So let's give you a little break from that and just say thank you for coming on this morning and highlighting for us just how much this is still a struggle for you, many people like you, having to deal with long COVID 5 years on. We'll be looking back throughout the programme this week on The Breakfast Show for you to the COVID pandemic 5 years ago here on CWR.